Hello everyone, this is the second Medico and we are going to see about the Lepra reaction. It is an hypersensitive reaction which usually occurs during or after the multi-drug therapy. It is usually cell-mediated immunity which is caused due to T-cell complexes, macrophages and monocytes. There are two types of Lepra reactions, type 1 and type 2. The type 1 is also called as reversal reactions and type 2 is also called as erythema nodosum leprosum. Type 1 Lepra reaction. In this type, the skin lesions which are already present become inflamed and become edematous and may even ulcerate. This is a type 4 hypersensitive reaction because it is cell mediated and it is caused by T cells, monocytes and macrophages, and this one is also called as delayed type hypersensitivity reaction. In this type, the pre-existing lesions change from hypoanesthetic state to painful inflamed edematous. This reaction is mostly seen in borderline forms of leprosy like borderline tuberculite, borderline leprematous types of leprosy. Type 2 Lepra reaction. This one is also called as erythema nodosum leprosum. In this thing, unlike type 2, newly occurring lesions which are erythematous shiny papules appear on the skin. This is a type 3 hypersensitive reaction which is due to the accumulation of immune complexes which should be cleared by the innate immune cells. So these start reacting against their own cells and may cause autoimmune diseases. This is mostly seen in lepromatous forms of leprosy, and this may result in systemic symptoms like orchitis, in which is enlargement of testes, lymphadenopathy, dactylitis, in which the toe joints and finger joints become inflamed. Now we shall compare both the reactions for better understanding. Type 1 Lepra reaction, also called as reversal, and type 2 is also called as erythema nodosum leprosum. In type 1, the already existing lesions get inflamed, but in type 2, there are newly occurring lesions, which are erythematous, shiny, and dome-shaped lesions. Type 1 is mostly seen in borderline, while type 2 is mostly seen in lepromatous forms. And type 1 is type 4 hypersensitive reaction, while type 2 is type 3 hypersensitive reaction. We can remember this by adding the corresponding numbers. Always the sum will be 5. So type 4 in type 1, so 4 plus 1 is 5, and type 3 hypersensitivity in type 2 Lepra reaction, 3 plus 2, 5. In type 1 Lepra reaction, the systemic side effects are not usually seen, but in type 2, already said like orchitis, dactylitis, fever, malaise, arthritis can be seen. In type 1 Lepra reaction, the immune response is mediated by T1 helper cells. In type 2, it is mediated by T2 helper cells. And that's it, and we are coming to the treatment part. The drug of choice for this kind of reaction is steroids, so that they reduce the inflammation. The drugs given are prednisolone, is given as 1 mg per kg body weight. Next, clofazimine. Clofazimine is already included in the multi-drug therapy. So if the patient gets a Lepra reaction, the multi-drug therapy can be stopped for some time, but clofazimine is continuously given so that it reduces the symptoms. And thalidomide. Thalidomide is not effective in type 1 Lepra reaction. It is effective only in type 2 Lepra reaction. Thank you for watching. Goodbye.